Hello everyone, welcome to this presentation. This presentation is especially for the international medical students and international medical graduate doctors who like to learn more about clinical audits. And I've made it a simple presentation so you can understand the basic concept behind audits and also can understand how the audits are done in a very simple way. And I'll give you some practical examples as well. So if you like to follow me on social media, I've shared some links as well on this slide, my Instagram page, the Facebook page, YouTube. I post normally about medical education and career pathways in UK. So let us start this presentation. The learning objectives from this presentation is about basic understanding of audit and what is an audit cycle and how they are done, planning and presenting an audit, practical examples of completed audit, and clarifying concept for the international medical graduates, because I understand that audit could be a very unique concept to UK. And if you're working outside UK, you may not have heard of audit. And this might be something you may hear about first time when you think about UK or you try to approach different recruitment agencies or jobs you might be asked to tell them about if you have done audit in the past. So let us start with the basic definition of audit. What is a clinical audit? This could be a question you may be asked in an interview as well. So it's very important that you have an understanding of clinical audit if you're coming to work in UK or thinking about it. In simple terms, clinical audit is basically comparing our current practice with some set standards. And this is a part of quality improvement activity. The main aim of an audit is to improve the quality of the service you're working in. And I'll give some examples in this presentation, and you will see how the service was improved while we conducted those audits. But this is a basic and a very simple definition of an audit to compare our clinical practice with set standards. There's some common myths about audits as well, and if you are working outside UK, you may have heard of those. That audit cannot be done outside UK. A lot of people say to me that, these audits are very specific to UK. I'm working in Pakistan or India. We don't do audits. We never heard of them. But audits can be done anywhere. If you're working in hospital or any clinical settings where you are coming in contact with the patients, where you are giving them care, then audits could be done there. Everywhere in the world, some kind of quality improvement activities always going around in hospitals or whichever clinical setting you're working in, but they may not call themselves or those activities audits. Sometimes people feel that a large amount of information is required to complete a successful audit, and this is not true. Sometimes small bit of information, just information based on a few patients or a ward, can be enough to complete a successful audit. People also get confused about that we may need to use Excel sheets and understanding of statistics, which is not true. I have done several audits in my career, and I've never actually used an Excel sheet and don't have to use any complicated statistics. So this is also not true. So it's not like research when you have to apply those statistics tests. Some people feel that audits can take months to complete, sometimes years, and that's also not true. If you plan an audit well, you can actually complete them within few days or a few weeks. Most of the audits I've done, I've actually been able to finish them within a few weeks. Sometimes people also feel that patient information is required. People who are not coming in direct contact with the patient, they are unable to do audit. That's also not true. A lot of the times, the audits are actually done on our own practice as well. So sometimes educational activities could become part of audit as well. Sometimes activities that students do or doctors doing within a clinical setting, which does not always involve directly a patient, may become an audit, and we can get some examples of that as well. This is just a diagram to show you the stages of a quality improvement activity, or you can call it an audit. First thing is to identify a problem. The second stage is to find the standards you're going to audit that particular issue about. Then you collect information, then you analyze the information, then you report your results, and then you make some recommendations. The first 6 boxes will complete the first audit. And if you're actually doing a quality improvement activity, multiple audits, then you will go to the next next part that you, after making the recommendation, you implement those changes. Then you repeat that audit and then report if there has been any improvement or not. So audits could be repeated multiple times if you are involved in a quality improvement activity. There might be multiple audits done over a number of years as well. But the first audit, is in usually the first 6 boxes, that you identify a problem, you find the set standard, you compare your current practice with those set standards. You report what you have found, and then you make recommendation how we can improve the service. So this is audit cycle, which is saying the same thing. This may be asked to you in the interview as well, that what is an audit cycle, or what is your understanding of an audit cycle. So audit cycle, as I said already, same thing. You identify a problem, you find the set standards, you compare your current practice against those set standards, then you find any shortcomings, then you reflect and plan some changes, and then you re-audit. So when you re-audit, you are again coming to the set standards and doing it over and over again. You can see if you keep doing this activity about a particular set standard and keep auditing, keep finding issues, keep trying to improve those issues, repeating that cycle over and over again can actually, in the longer run, improve the quality of a service. This is again a very common question which we get when we talk about audit, that what is the difference between audit and quality improvement activity? Audit, as I explained, is normally the first cycle of a quality improvement activity. So if you're only doing this initial bit, which is identifying a problem, finding a set standard, comparing your current practice, and then identifying where are the shortcomings, and then making some recommendation, that's just a simple audit. But when the quality improvement activity is basically when you go a step beyond that and you start doing multiple audits. After identifying issues, you implement changes, then you re-audit it, and then you again implement changes, identify more issues, and then re-audit it. That repeated cycles of audit will become a quality improvement project. And then sometimes this question is also asked commonly, that what is the difference between audit and research? And this is sometimes asked in the interviews as well, because they're trying to check your understanding of audit and research. So in audit, you are actually not trying to generate new information. The information is already out there. You are just analyzing your current practice against set standards, and that information is already available to you. In research, in general, when you're doing research, you're trying to create new knowledge which was not there previously. So research is actually something else when you are investigating and trying to find something new. Whereas audit, the information is already there, and you're just trying to see to see that analyze yourself against some such standards. This slide just explain the common issues when people have faced doing an audit. If you are new to doing clinical audit, or this is your first time you are trying to do clinical audit, this is what I ask people to avoid. Basically, try and keep it simple. If this is your first audit, or even, if I have experience of many years now in NHS, and if I'm trying to do an audit, I will always try to simplify it first. Then also you need to anticipate time as well. A lot of students and a lot of doctors I know, they will start a audit, but then they will not realize how much time consuming it could be, and then they will lose the energy, they will not complete it. Then when you come to the information at the stage when you're gathering information, then you need to be sure that you have the access to right amount of information. Because if you have planned an audit and you've got a really good idea, but if you cannot get the right information, that will actually stop you in your tracks. And then always, as I said, when you are auditing something, you have to find the right guidelines, because that is what the basic spirit of audit is, that you are trying to compare your current practice with some set guidelines. Some people have said to us that, they have done an audit, but they don't know how to write it. So audits are written simply as you write any abstract. For research, similar template, you can say. You write from the aims and objectives. What was your aim? Why were you trying to do that audit? Simply, aim could be a line or 2 lines. Then you write a bit of background that why it was important and how you have identified that problem. Then how did you gather that information? What was the method you've used? Then you will report the findings, and then you will report the recommendation and conclusion. So this is the very simple template you can use to write any audit. You don't need to use many words in that. Maybe 300, 400 words should be enough. And this is something that can go on a poster form, could go in your CV as well if you have completed an audit. And I will show you in this presentation some of the abstracts we have written for some completed audits we have finished. Presenting an audit, a lot of people have come to us and said that, they have done an audit in a department in Pakistan or India, wherever they're working, but they don't know what to do with that audit. So they ask us, when you complete an audit, what do you really do with that? So the first thing we do with audit is to identify the local stakeholders, that who is this relevant to. So if I have done an audit on a particular ward, and I have identified some issues on that ward, some standards we are not fulfilling. The stakeholders of that ward would be the staff working on that ward, then maybe junior doctors, senior doctors, middle grade doctors, other staff. So the first presentation, we try and inform the hospital or the ward wherever we have finished audit, and they do basically share our findings with them. Then in UK, there are some deanery level events as well for audits. We take our audits to there as well. There's some national level events, which is conferences. Audits can go as posters in the conferences as well. And I would like to say that, if you are an international medical student or an international doctor who has done an audit in the home countries, they can also consider submitting those as an international poster to the UK conferences as well, because quite commonly UK conferences are accepting quality improvement activities, posters on that, and audits as well. So let us get some examples of completed audits, and this will clarify your concepts of how these audits were done and the simple steps that were taken to complete those audits. The first one would be admission clerking physical health check. This audit was done by my junior doctor. And there's a lithium monitoring audit, which is a very common audit, which is specific to psychiatry and done very commonly in UK. The first two audits are not specific to psychiatry. They could be done anywhere. Admission clerking, by admission clerking, we mean that when the patients are getting admitted to the ward, the standards of history you record. Let us take some examples. But before we go to the practical examples of the audits, let's just clarify what is the stage of an audit. When you're actually doing an audit, what stages you should plan. First thing would be identifying the problem and then getting an idea of what you are trying to do. The second, as I already mentioned, and finding the right guidelines, because if you have identified the problem, you also have to identify what are the set standards in that to solve that particular problem. Then developing an audit tool or a form which you will use to record information on. So that I will share in a minute with you when I am sharing the examples of the audit. Then you gather the information on those forms, and then you analyze that, and then you write an audit results, and then make the recommendation, and that will complete the different stages of a simple audit. Let's come to the admission clerking audit and physical health check, and this could be done anywhere in the world. If you're working, for example, on any ward, you can think of something similar. I'm sure this sort of thing is already going on around the world. They might not call it an audit, but this sort of standards are checked around the world anyway. So admission clerking is basically a very simple thing that a patient is admitted to the ward. What is expected from the admission initially, like from the junior doctors working there or the staff working there. So for example, if I'm working on a mental health ward, the expected standards is that if somebody is admitted, a patient is admitted to the ward, somebody will need to take a good history from them. They need to do a mental state examination, which is specific to psychiatry, a basic physical examination, and then we normally do an ECG and take some routine bloods as well. So these are the very, very commonly expected standards for anybody who's coming to a mental health ward. So this audit was basically to check the patients who are getting admitted to particular wards on our mental health unit, were these expected standards met or not. So as I said, once we have identified the problem that we need to check the standards of admission, Then we have found the expected standards as well, which were in the local guidelines of the Junior Doctors Handbook. Then we developed this audit tool for admission standards. So you can see that this audit tool is a very simple A4 size form, which we were going to fill for every patient we will audit. On top, we can just identify the information of which patient we are doing the audit on. Then the standard one was clerking of the patient, which means that if the history of the patient was done on admission, the mental state examination was done or not, the physical examination was done or not, because the standard we had was this must be done within the 72 hours. You might not be able to do on admission for several different reasons. If it was not done on admission, what was the reason documented there or not? An ECG was done, or if it's found in the notes or not. And then routine bloods were done on admissions or not. So these were the 5 standards we were trying to check. So if you are doing this audit in another setting, like for example, you can take a simple aspect of this audit and expand on that as well. Like for example, a physical examination, I've just put as a standard here. On a medical ward, you may say that, if somebody is coming to a ward, the physical examination may include several different parts. Was their chest examined? Was their abdomen examined? Was their general observation recorded or not? So that, you can expand on that as well. But for this particular audit, we were not looking for in-depth information. We were just looking for a basic physical examination, which is a requirement for admission on a mental health unit ward. So after we have done the audit tool, we identified the patients and we did the retrospective data collection. And most of the audits I've done, I've always done retrospective, but it could be done in another way as well. By retrospective, I mean that we were not looking for the new admissions. We were looking for patients who were already admitted, and we were looking in the past that if this was done. So we started to we identify all the patients who were at that point in time admitted to our mental health ward. We started looking through their notes, and this was especially for the old age psychiatry wards, and there were 4 wards involved in this audit. So every single patient we identified which was admitted to the ward, for every single patient we filled that form, and then at the end of that we had around 40 plus forms. So this is the final outcome of this audit. It was finally done as a poster, so you can see the same audit aims and hypothesis is written there. The background is written there. How we were gathering information is written there as well. How many cases we found. So 48 records were audited and that's checked against the set standards. And then we found some cases where we were not meeting the set standards, and then we made some recommendations as well. So this is how this audit was completed, and then it went to a local conference as a poster. And this is a poster in front of you, which is basically an abstract we have put on a poster form. Now, the next audit I'll talk about is the lithium monitoring. And lithium monitoring is more specific to psychiatry. But, if you are working in other clinical areas, you can find what are the other requirements for monitoring. If you're using a medication which requires monitoring, you can use the similar standards if you can find them. The lithium monitoring audit, if people who are working in psychiatry would be aware that lithium carbonate is a very commonly used medication in psychiatry, commonly used for bipolar, and sometimes patients who are not responding to the treatment for low mood as well. This is a specific medication because it's known to have a narrow therapeutic index, which means that it requires close monitoring. And lithium monitoring has 2 aspects. You can say that, once you are starting patients with lithium, there are certain set standards. You have to do certain tests. You need to make sure certain things are in place. And then somebody who is already on lithium also require ongoing monitoring as well. So the guidelines in that which has been used are the Mosley prescribing guidelines, but NICE guidelines is also available, and other guidelines about lithium are always there. But Mosley prescribing guidelines is something which we use very commonly. Lithium monitoring audit, as I said, lithium monitoring audit could be divided into 2 aspects. 2 different audits could be done, given the fact that, the monitoring requirements are 2 different levels. So pre-treatment test, if somebody is going to be started on lithium, what is required that we need to check their renal and thyroid and cardiac functions. estimated EGFR, serum calcium, thyroid function tests. They need to have ECG, and the weight need to be monitored and recorded. If somebody was on the ongoing treatment of lithium, then their plasma lithium level, EGFR, thyroid function check should be checked every 6 months, and weight and BMI also need to be monitored. So these are the set standards which are also already available in our guidelines, and these are like national level guidelines. So we can easily get the guidelines, and we know the patients who are on lithium, and we can check if those standards are met or not. So this is, again, once you've identified a problem, as I said, and you found set guidelines, then you can create an audit tool. Simple audit tool, name of the patient, their hospital number, their age, sex, and then depending on which audit you are doing, if you're doing the pre-treatment test audit, you can simply record when the lithium was started, started in patient and community, and then the tests which are required was once they were getting the lithium started, have they check their UNEs and EGFR, serum calcium, thyroid function test, ECG, and weight, and if this is recorded in patient notes or not. If you're doing an audit from another angle, when you're auditing the patient who are already on lithium and you are retrospectively looking back at them, you can simply see that have they been having 6 monthly checks, their plasma lithium level, EGFR, thyroid function test, and their weight in BMI has been recorded or not. And if you apply this tool to the patient information, then you will get an idea if you are meeting those standards or not. If you're not meeting those standards, what are the reasons? If that particular aspect which is not met could be improved in some way. So again, once you identify the patient which are on lithium, you can again do this audit retrospectively. So patients who were identified are taking lithium at this stage, you can look back on in the past record, set a time frame of how many patients you're doing, what are the time frame, and looking at patients who were started on lithium in the last 1 year or last 2 years, last 6 months, whatever time frame you like to set. Gather that information from patient record, compile those results, and then report them. So this audit is not done by myself, but this is done by another team. But it's British Journal of Psychiatry open supplement, and it was part of a conference. You can see the abstracts is written very clearly how they did the audit, and it was done as a poster in the conference. And results, they were looking at 120 patients in the study, and what they found out. The different tests that were done, and if they were not done, the conclusion they have written as well. So this is the last example, and thank you for listening to me. I hope this presentation of audits and the examples I've given you will give you some ideas of how to do an audit and how to go about it, how to start your first audit. If you're starting your first audit, please try and keep it simple for the first time, because you need to go through the process to understand if there's any pitfalls or any things which you struggle with and how to overcome them. Thank you very much again for listening to me.